Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 19 of Lengthening Live, where the patients get to interview the guests. And today I'm joined by a legendary lengthening surgeon, Dr. Dimitrios Giotikas from Athens, Greece. Dr. G, how are you doing today?
I'm fine. Thank you, Victor. Thank you for having me.
Yes, absolutely. It's great to have you back on the show. So, Dr. G, you're located at both Athens BJR and Athens, Greece, but a lot of patients have also noticed that you also perform surgeries in the UK. Can you tell us a little bit about that, of how you split your time between both the UK and Athens, Greece?
Yes, it's exactly as you said. I split my time, so I would find myself in Athens almost every other week for the whole week, or sometimes every second week. I usually stay there for the whole week. Monday is a day for preoperative assessments and follow-up consultations and X-rays of patients who have already been in Athens and they are recovering in Athens.
Mm-hmm.
Tuesday, Wednesday, and Thursday are surgery dates, full theater lists, big cases, big limb reconstruction cases, including cosmetic limb lengthening, because I understand that your audience is more focused on cosmetic limb lengthening. So big limb reconstruction cases on Tuesday and Wednesday routinely, and Thursday smaller cases like
Mm-hmm.
knee replacements or nail removals and small stuff. Uh, Patients stay in the hospital until Friday or Saturday. I'm there, they leave the hospital, and then my team takes over, nursing team, physiotherapy team. I have another experienced consultant in Athens, Dr. Giannakos, and they take over the care of the patient, always with under my instruction.
Mm-hmm.
Nowadays, you have to rely on a teamwork to provide good quality healthcare. It's not one-man show anymore, as it used to be some years ago. But and of course, technology is really important because nowadays we're able to see X-rays or blood results or communicate with patients and our team very easily with online means and electronic means. So under my care, I provide instructions to my team. I solve problems when necessary. I talk to my patients. All my patients in Athens have a direct line to find and contact me almost 24/7. And from there on, I can, allocate things and delegate things to be done by my team. So there are boots on the ground to take care of things when I leave Athens. And the same thing happens in London when I'm not here.
Oh, that's amazing. Wow, you are a busy character and you are in multiple places, but you also have a medical team at both sites to care for your patients. That's amazing. Now, Dr. G, you recently implemented the use of the G nail, the Goucher nail, into practice as an internal lengthening nail option that has a full weight bearing capacity. Now, this is helpful to enhance mobility for bilateral stature lengthening patients. Can you tell us a little bit more about this device, how it works, and how it compares to other options on the market?
Yes, it works well. My early experience is very encouraging and satisfactory, meaning that what I saw from the data that Dr. Gise provided, like 700 cases with Gise nail and Albizia nail, what I saw from this data in terms of healing times, recovery times, pain levels, etc.
Mm-hmm.
And also when I met some of previous patients and examined them and discussed, it is working as described and as expected.
Okay.
My early experience is that it is more demanding than magnetic nails,
Yeah.
meaning that it requires daily hard work from the patients with stretching and exercising in order to maintain their muscles warm, if I'm allowed to use a term, and active and flexible. And this makes the clicking maneuver, which is the twisting maneuver that they need to do with their legs in order to produce the lengthening.
Mm-hmm.
So it is more demanding in that way.
Gotcha.
Uh, it is less forgiving. So if, for example, with Stride, when we had it, or with Precise now that we have it again,
Yeah.
if with these magnetic nails patients could get away with 1 or 2 days of being a bit lazy or not in the mood of exercising. That's not the case with Guiche nail. If you do that for a couple of days in a row, you end up with cold and not very flexible muscles, and this may make clicking maneuver a bit more difficult. These are my early observations about how the nail works and how patients behave with the nail. What else? I have seen that there is an anticipated period of increased difficulty with clicking, starting from roughly day 12, 13, and lasting until day 20. So basically, we're talking about more or less the third week after the surgery, when the inflammation phase of the healing response of the fracture, of the osteotomy, I mean, kicks in and makes clicking a bit harder and more difficult, a bit more painful. But this is something that we know. This is something that we anticipate. We help patients during this period of increased inflammation with short-term of anti-inflammatory non-steroid drugs like ibuprofen or diclofenac, and this helps them significantly to reduce this inflammation and allows click to continue. We also increase the lengthening rate for this period. So instead of doing 1 millimeter, that is 15 clicks for these 7 days, ideally we advise our patients to do 21 clicks.
Okay.
So that's like 1.4 millimeters for a short period of time in order to overcome this inflammation period. And after this third week, things usually become easy and comfortable again. And I'm going to say this because I can still see and feel, I can see it from patients already in Athens and feel it when I talk to patients that are considering coming to Athens and having it done with G-nail, with Guiche nail. They are still afraid of it because they don't know it. I think this is going to be a temporary sensation. At once the first patients start talking positively about their experience and their outcome, people will feel more comfortable with Guiche nail. But I want to say about pain that it is probably 20 or 30% more painful compared to what stride used to be, or what size is going to be now that it's back. Meaning that throughout the day, the pain is more or less the same with both nails. Pain comes from the lengthening, comes from the physiotherapy, or after the physiotherapy. Sometimes there is pain in the night for some reason, maybe because the muscles relax a little and the leg is more unprotected in the night or more cold as the temperature drops. So there may be periods of pain through the day with both nails, and it seems to be more or less the same. But in addition, as you probably understand, with Guiche nail, we have the additional discomfort of clicking, not during the clicking, but sometimes it lasts for a few moments or like 30 minutes after the clicks as well. So I think that this probably counts for an increased 30% of total perception of pain, if I'm allowed to describe pain that way, compared to magnetic nails. We have a lengthening diary that we give to our patients in order to write down their clicking routine, how much time they need, what was the difficulty, how much pain they had. They rate their pain from 0 to 10. So these are my first observations about how Guiche nail works. It's been around in the market for more than 15 years, more than 10 years at least, in the latest version, with very predictable performance in terms of biological compatibility. So I think that it's a very reliable and predictable solution for someone who is prepared to be disciplined and dedicated and hardworking throughout the lengthening phase, which is in any case a prerequisite for success, no matter what the nail is. But this is particularly important for GNA, for GSNA.
Yeah, absolutely. That was a very thorough explanation. Thanks so much for that. Because a lot of patients are, wondering about this. They want to know for full weight bearing options right now because of the Strides recall, and this is providing that for them. So you're one of the providers. So now they know about that. Excellent. Now, Dr. Giotikas, why did you choose the G nail over other weight bearing nails? Like you have the Betz nail from Dr. Betz in Germany. It has a similar ratcheting mechanism, clicking mechanism. What was your reasoning for choosing the Goucher nail or the G nail over that?
You're right. Both these nails, Goucher nail and Betzbone nail, are derivatives of the BJR nail with modifications. The reason why I chose Goucher nail was mainly because it is approved and it is available in the United Kingdom, where I also work. And this is important for me, not only because I work in London and United Kingdom as well, but because for me, the M8s are a medical and healthcare product regulatory agency. That's the authority in the United Kingdom which regulates and approves implants, devices, medical devices, products of all sorts. It's like the FDA that you have in the US.
Okay.
So I have come through my working in the United Kingdom for the last almost 10 years. I have come to appreciate the diligence that UK authorities pay to these things. Let me remind you that it was the very same agency who stopped Stride and Precise in Europe. So because Unilateral was available and approved in the UK where I work, and this gives the confidence that it has been scrutinized promptly. And because I happen to know Dr. Giotikas from a previous meeting that we had some years ago during a scientific symposium, and also because the last time I checked, Betzbone nail was not commercially available.
Okay.
And it's meant to be used only by Dr. Betz. So my first thought was, for all these reasons, to contact Dr. Giotikas, and he then introduced me to the manufacturer of the nail, which is Exos company. And this is how this collaboration started.
Okay, that's excellent. Wow. So that makes sense. You work in the UK. It was approved by the regulators in the UK, and it all worked out for you in the end. Excellent. All right, moving right along here. The next question that the patients had for you was this: how do you prevent the runaway lengthening? So in certain nails in the past, like the ISKD, there was something called runaway lengthening where you would, ratchet the device, and it could happen when you were sleeping. And how do you prevent this, or what are your precautions to take while using the G nail because it doesn't have a reverse lengthening mechanism like Stride does? So what are your protocol for that?
I think there is a confusion here, and I see this repeating pattern of people being confused with this. The runaway nail and the runaway term was not introduced 20 years ago for Albizia or Goucher nail or Betzbone. It was for another distracting nail. It was ISKD from orthodox. That was a different nail, and this had this particular problem of running away and of lengthening uncontrollably. What happens with Goucher nail is that there might be a few accidental clicks, especially in the first days, until the patients learn how to use their legs and how to move their legs and their body.
Okay.
There may even be a few accidental clicks initially at sleep. It's not that easy to happen. Even if it happens once or twice or even 3 times in a day, it's not a huge problem. First of all, because each clicking, it only produces a fraction of millimeter
I see.
So you need 15 clicks divided by 3, 5 in the morning, 5 in the afternoon, and 5 in the evening in order to have 15 clicks and your 1 millimeter of lengthening. So if you have 1 or 2 or 3 additional accidental, it's not a huge problem. You just add them up in your next session. As I said, there is this diary, this lengthening diary that the patients fill in, so they just calculate these accidental clicks. So it's not something that happens frequently.
Okay.
It happens only occasionally, only at the beginning. And in any case, as part of my protocol, when we have finished lengthening, we do a full length X-ray scan around the legs, and we measure the full length of the legs and also the full length of the segment that we have lengthened, in this case femur. And if we see any repeating pattern of a few millimeters of difference, we can easily equalize them by asking the patient to lengthen a bit more. Not reversing. You're right. Guichet nail does not have this reversing option, which I think, in my opinion, is not a huge limitation and a huge shortcoming for femur and for cosmetic lengthening. And I'm saying this because cosmetic lengthening patients are always young people or youngish, healthy, fit, not obese or anything, and without any previous, history of injuries or surgeries in the area. So in this context, it's very unusual and unlikely for non-union to happen. So this not reversing is not a huge issue for me. I would be more concerned if I was using Guichet nail in the tibia, but in the femur, I have never seen non-union developing just because of lengthening.
Okay, that's excellent. That's good words of encouragement for the patients who are going to take the G-nail as an option. All right. So the next question that they have about the G-nail is, how is it able to lengthen up to 1 centimeter safely during surgery? Wouldn't this have an adverse impact on the stretching the surrounding nerves, tendons, muscles, and other soft tissue? Because I think that you do it intraoperatively to test the nail. Can you talk about that type of amount of length versus the typical 1 millimeter that the Precice or the Stride does?
Well, it's not 1 centimeter. It can be 1 centimeter, but I usually do 8 millimeters.
Oh, okay.
The idea is that you need some. In addition to checking that the nail works properly, you need some clearance between the two ends of the bone in order to rotate freely rather than rubbing against each other. So we need to give a few millimeters of clearance during the surgery. So that's the reason why we're doing this, as opposed to not doing this with magnetic nails, where we only give just 1 or 2 millimeters just to confirm that the magnetic mechanism works properly. That's the rationale of doing this 8 millimeters or 1 centimeter of lengthening, as other doctors might do. In terms of this being dangerous or risky for the fractures, no. There is another, confusion or misunderstanding here. You should not be thinking that soft tissues like tendons or nerves or vessels are like inactive rubber tubes which stretch and relax according to the force applied. They adjust. 1 centimeter is something that they can tolerate very, very easily. And you should imagine all soft tissues, muscles, tendons, skin, cartilage, vessels, more like a dough, like a raw bread dough. If you stretch it, you will feel the tension in your fingers, but if you persist, it will relax and elongate without being under tension. Okay, so if you leave the dough in a stretch position, it will stay there. It will not shrink back completely. This is how soft tissue behave, and this the scientific term for this is stress relaxation.
Okay.
So it's not a problem at all lengthening 1 centimeter or 8 millimeters in one go. When this happens, then it fills with blood, local hematoma because of the fracture, and then the healing response starts in the next days with little tiny vessels starting from the ends of two bones, trying to reach and bridge the gap. And this process follows normally with latency period and etc. and healing response. The problem would be if we kept lengthening uncontrollably for the following days or weeks, not allowing these little tiny vessels to find each other and create a network of blood vessels bringing nutrients and substances to the healing bone.
I see. That's a good explanation. That's really cool. I didn't even know that. So really good. All right. Okay. So this one's more of a general question. Patients who were, thinking about going to you, they're asking, what type of tests or examinations do you do when they come in for a consultation in person before surgery?
It depends on the patient. It depends on the condition that we are about to treat. It depends on whether or not there is a deformity and where is the deformity, femur or tibia or both. What kind of deformity we suspect that this is just bending, just twisting and bending. So all these are factors who come into play in order to decide what scans we need to do. Also the patient themselves, are they elderly, are they young, do they suffer from conditions like diabetes, like rheumatoid arthritis, previous injuries, previous infections. In the context of cosmetic lip lengthening, because as I said, I think that this is what your audience is more interested about.
More so, yeah.
There is usually consultation at around 2 months before they come to Athens or London to surgery. It can be done either online or face-to-face, depending on the patient's location.
Okay.
And there is also medical questionnaires that patients need to answer about their any pre-existing medical history, pre-existing medical conditions, allergies, dietary habits, all sorts of stuff. And then there is the consultation. If there is any concern in my mind that we need to investigate things further before they come to Athens, I will ask them to do blood tests. I will ask them to do a CT scan or X-rays in order for me to be able to formulate a plan before they come to Athens, because I don't want my patients to come to Athens without me having a plan about what is going to happen and what we're going to do. So depending on the condition, I may ask for a CT scanogram with rotational profile in order to measure any deformity in the femur or tibia, bending, twisting, shortening, lengthening, or combination of any of those. I might ask for simple X-rays if, for example, I have a case for cosmetic lip lengthening and they are kind of overweight, like more than 70 kilograms, and I'm a bit worried that I might not be able to use a thicker nail to support their weight, and I ask for X-rays before they come to Athens. In different clinical scenarios, I may ask for blood tests to exclude any active infection, for example.
Gotcha. Awesome. That's very thorough. It sounds very, very standard too.
The important message to send is that all these things are decided during the preoperative consultation, either online or face-to-face, depending on patient's preference. And this is done at around 2 months before they come to us.
Okay, gotcha. Because I guess you have two consultations, one virtual or like a pre-consult, and then when they come there, you do another one.
When they come to Athens, they usually come a few days before their surgery, and on the day before the surgery, we will do preoperative checks at the hospital, which X-rays, if we haven't done already, X-rays, just for me to know what size of implant I will probably be using next day. It involves X-rays of the chest, electrocardiogram, and assessment by a cardiologist. If there are any concerns, we may add an ultrasound of the heart, although it's usually not needed in young and healthy persons undergoing cosmetic lip lengthening. Anesthetic assessment, blood tests, full blood count, coagulation tests, what else? Cross mats in case we need to do blood transfusion.
Yeah.
Of course, clinical examination by myself.
Right.
They sign the informed consent form.
Right.
I send the informed consent form during the consultation 2 months earlier, but they sign it when they come to Athens just before the surgery. I give them time to read it again and ask any questions. I want to be very informed when they come to Athens.
Okay. Yeah, I remember the day for my own surgery way back when. Brings back memories. All righty. Moving right along here, Dr. G, we have a few more questions, and then we won't hold you too long because I know it's late over there in the... No, okay. We appreciate
I'm in the United Kingdom at the moment, so it's only 9:30 almost. So it's okay.
Oh, 9:30. Oh, you're in the UK. Okay, I thought you were in Athens. Okay, very cool. The next question is, for patients who can't stay in Greece for more than 90 days due to not being a European citizen, how do you manage the post-operative care? Should they go home, or should they try to like get a visa? What is your recommendation?
First of all, it's not a problem for anyone who wishes to stay in Athens for more than 3 months or for as long as they like.
Oh, really? Okay.
Within reason, of course. It's not a problem to stay with us. They are welcome to stay for as long as they like, and this is something that I keep telling to my patients before they come and when they are in Athens. We can easily extend their visa or their permission to stay in Greece by providing a medical certification explaining the reasons, the medical reasons and the medical necessity for them to stay for a bit longer with us in Athens. So for anyone who wants to stay for more, it's not a problem.
Okay.
But if someone wants to fly out sooner, like even before completion of lengthening, under certain prerequisites, if they are compliant, if there are certain amenities and facilities back to the country they are flying to, we can also facilitate this.
Okay.
So I don't think it's a problem. You
So
can assure your audience that they can stay for as long as they feel that they need. But in any case, they should be prepared for a minimum of 6 weeks in Athens.
Okay, try to like stay for a minimum of 6 weeks in Athens. Okay, that's very good, very clear. Alrighty. The next question is from a patient who I think they had bowleggedness. A little bit of varus. They were wondering if they have bowleggedness and they also have a leg length discrepancy, how would you consider fixing the deformity first and then balance the legs with lengthening, or would you do them simultaneously? Now I know you mentioned you would do a CT scan and all that, but what would be your best plan of attack for this?
The scanogram I mentioned earlier, the CT scanogram I mentioned earlier, it was just the diagnostic workup of the treatment. This is just for diagnosis, for me to understand what's happening and what we need to do. But in terms of treatment, if it's not a huge deformity, usually we can correct it acutely during the surgery. Again, depending on the clinical scenario, if we're going with internal nails, lengthening or others, and if the deformity is a few degrees of bending, we can correct it acutely with the use of Poller screws. That's Poller screws or blocking screws. This is a special technique that we utilize screws around the nail in order to direct the position of the nail, and that way correcting any small deformity. If there is a more complex deformity, like a combination of twisting, bending, and translation, so you can have if you have a broken bone, you can have a translation, bending, twisting, okay, and shortening, for example. Okay, you can imagine that this is a complex deformity to resolve just by thinking and drawing lines on a paper. And we would use what is called Taylor spatial frame. Taylor spatial frame from Smith and Nephew, which allows you to do some measurements of angles and distances, and then you feed the software, and it produces a prescription for gradual correction. And this is something that we can do in the tibia. In the femur, we can do the same intraoperatively. We can apply a simple frame, do the calculations with the software, and IQ correction, then insert a nail. This is what is called the chaos technique, computer assisted correction.
Oh, very cool. That's awesome. Well, that person is going to hopefully, they'll be all fixed up all at once.
Your friend who is asking,
yeah.
I would anticipate that in most cases we would be able to do it simultaneously.
Okay, at the same time.
Lengthening, equalizing the discrepancy, and also sorting out any angular deformity, any angulation, any bending.
Yeah, the bowleggedness. That's excellent news, because they were worried about having to do 2 surgeries, so most likely they could do it in 1. All right. The next question is from a patient who is asking, do you suggest that a patient, I think that they're talking about for tibial lengthening, do you suggest that a patient use just like a Taylor spatial frame for their tibias? Is it relatively safer than the lengthening over nail or another internal nail method for tibial lengthening? So would it just the Taylor spatial frame, just an external fixator versus the lengthening over nail or an internal nail? I guess because you have to go through the patellar tendon.
Again, in the context of cosmetic lip lengthening, if we want to be honest, I think the main limiting factor for those decisions is the budget. Okay. People choose frames or combination of frame and nail LON or LATN,
Yeah.
mainly for budget reasons.
Right.
Because the truth is that internal nails are more comfortable and safe. And I think they
Yes.
are as safe as external frames.
Mhm.
External frames are very safe as well and very predictable. They have been around for many decades. We know how to use them. Uh, I think that they are at least as safe as nails,
Mhm.
certainly less comfortable. And then LON is a bit less safe because there is an increased associated risk of deep infection when
Oh,
you have
right.
simultaneous presence of an internal implant and then wires and needles going through the skin, muscles,
Mm.
through the bone, and very close to the nail or in contact with the nail. There is a chance that a few bugs may find their way through the skin in the bone and initiate an infection there.
I see.
So there is an increased risk of infection with LON. This is why
Mhm.
LATN, lengthening and then nailing, was
Yeah.
introduced,
Okay.
where you remove the frame and then insert the nail.
Mhm.
Slightly better chances of deep bone infection, but still higher than nailing only or frames only. So my answer to the question is nails, then external frames only for someone who can tolerate them for 7, 8, or 9 months,
Okay.
and then LATN, and then LON.
Oh, wow.
With LON especially, or LATN, I think it's a no-no for the femurs.
Mm.
I think it's unsafe to do LON in the femur
Okay.
because it's done with monolateral frames, and it's repeatedly it's notorious for infection,
I see.
eye-to-band problems, and significant knee stiffness. So this is another factor. In addition to infection, this is another factor of safety that patients need to consider when the budget doesn't allow
Right.
nails.
Yeah. Okay. Wow. I
And I
like
think
that little.
the last comment was about the femur. Okay,
Yeah.
external frames in the tibia is a reasonable option.
It's an option. Okay. So yeah, but he's
Or
talking. Yeah, to clarify, guys, he was talking about the lengthening over now and the femur is not recommended because of deep bone infection. All right. Well, that was a really cool ranking of how you gave that. You know, so he said internal nails, external fixators, just pure external fixators, then lengthening and then nailing, and then lengthening over nails. Just so you guys to clarify.
for
Yeah,
tibias.
for tibias. Yeah, for femurs it's completely different. So, okay. All right, Dr. G, the elephant in the room. Here's the big question that everybody's been asking me to ask you, and it's patients online are worried about developing an embolism that could be, very serious. There was a patient whose lengthening journey they were following, and they were asking the following. So basically, could you basically explain what occurred with a patient case? You don't have to give any identifying details, but basically it's just saying that there was a patient who developed an embolism and had a complication. If you can explain a little bit about that.
Yes, we have received emails after this incident from patients asking about what happened and to give them information. Yes, I confirm we had this unlucky incident where a patient died because of fatal massive pulmonary embolism at around 7 weeks after their surgery.
Mm.
Um, there are certain things that are usually done when such serious incidents occur. So a scrutiny and a root cause analysis was done by independent experts, and it was confirmed that our protocols with regard to the process of informed consent, the blood thinner and anticoagulation protocol, and also the actions that were undertaken immediately once the incident happened, were according to usual and acceptable and safe standards. So that was a small relief for us. But nevertheless, it was a sad incident, and it's one of the incidents. It's one of the incidents that unfortunately happened despite all precautions and all reasonable measures. What else would you like me to?
No, that was a thank you for doing that. I mean, they've been pushing me to ask that question, and I decided to do it. So I really appreciate you doing that.
What is important here, because I said that we received emails asking.
Yeah, so I was just
yes, I think the main reason behind these questions is that patients are really worried about the risks of surgery for themselves. And the truth is that pulmonary embolism, which is different than fat embolism, let me say in a quick parenthesis, is a potential risk. Doesn't happen very often. It is something that we discuss thoroughly with my patients during the informed consent process. And during this consultation, I told you earlier, 2 months before, I explained to them that in a healthy, fit person, the possibility of blood clots in the veins of the leg, that's deep vein thrombosis, is around 1%. Maybe it's a bit higher to elderly people, around 2%. The possibility of pulmonary embolism, that is the clot finding its way to the lung and causing an obstruction in the vessel of the lung, is probably 1 in 1,000, maybe a bit less. And the possibility of that being fatal is probably 1 in 7, 8, or 10,000, probably 1 in 10,000, especially in young and fit and healthy persons who mobilize quickly after the operation. We know for a fact that there is published evidence that a recent major orthopedic surgery is a predisposing factor for thrombosis.
Okay.
At the same time, and this is up to 3 months.
Right.
Up to 3 months after a major orthopedic surgery, there is statistically increased risk for thrombosis.
I see.
But at the same time, we know that the risk is significantly less, very, very rare, and very, very unlikely after 5 weeks.
Okay.
And then the discussion starts, and it's a long discussion, very complicated discussion about blood thinner protocols and for how long and what kind of medication. We have injections. We have recently tablets like Xarelto or Eliquis, blood thinner tablets. The well-known aspirin also is recommended by some protocols. So there is a long discussion, and there are guidelines, because exactly all these medications have significant risks if they're taken unnecessarily or for a prolonged period. There is a long discussion, and there are guidelines that are produced from time to time from scientific societies. For example, your very well-esteemed and very prestigious American Association of Orthopedic Surgeons produces guidelines.
Yeah.
Also, here in the UK, the NICE Institute, National Institute of Clinical Excellence, produces guidelines, and they always base their recommendations in this balance between risk and benefit.
Yeah.
And just to give you an idea, they recommend 2 weeks of blood thinners for after a knee replacement in an old person. They recommend 4 weeks after hip replacement in an old person. Weight bearing and previous history are really important factors in deciding for how long it should be reasonable to give blood thinners. So obviously saying give them for as long as for forever or for 3, 4, 5 months is the easy thing, but it's not. I think it's not something that it is recommended by anyone.
I see. Okay. Very, very thorough explanation. We really appreciate that. So you had touched on the statistics, which was my next question. And I guess the next thing is that if a patient does develop a PE, what is your typical plan of action? They're just wondering, like, you said longer duration of Xarelto or anticoagulants are not always recommended. But if a patient does get it, what's your typical plan of action? And that's the last question they had on that.
Okay, first of all, let me clarify that, as I said earlier, in continuing my previous comment,
yes,
it comes at the end of the day, it comes to assessing each patient individually, and the protocol that I have been using for all these years, and I will continue using, is in someone who has no history of previous thrombosis or history of predisposing factors like diabetes or hormone replacement therapy. And if they mobilize well, 3 weeks, maximum 4. And then, depending on pre-existing history and their mobility status, we may extend if necessary. I will continue doing this personalized approach as I have done all these years. If pulmonary embolism does happen, it usually gives symptoms. It may be asymptomatic, okay?
Right.
Usually, most of the times, it is very mild symptoms or even asymptomatic. But when it gives symptoms, it may be subtle symptoms like just a small shortness of breath for a period of time, or proper shortness of breath, maybe a chest pain, sharp chest pain, cough sometimes. If we have such symptoms, the protocol says that we will take the patient to the hospital. We will do a spiral CT scan of the chest to confirm the diagnosis, depending on how severe it is and the clinical condition. We will either increase the blood thinner dosage from prevention dosage to treatment dosage, or we can even consider thrombolysis. That's the administration of special medication to dilute the clot and release the vessel. So this is called thrombolysis, or lysis of the clot in simple words, in lay terms. And these are things that are done globally when these problems occur.
Okay. Very, very thorough. That's going to answer all their questions. I appreciate you taking the pressure off of me, Dr. G. All right. All right. So last 2 questions, and then there's a few questions from the chat. What's that?
No, it's fine. Carry on.
Oh, okay. So this question is about patients who come to Athens. Basically, recently I reached out to Anta about securing, discounted pricing of hotel stay while they're there. So she said that you have both the Athenian Montaza Hotel and the 5-star Grand Hyatt Athens Hotel. And she replied that both hotels have an easy step-free access for people with mobility difficulties, wheelchairs. They also have a regular cleaning service, a restaurant for daily meals, and they're both located on the same street, just opposite of each other, which makes getting to and from the physio center very easy and cost effective. Now, my question that the patient had about that was, if they were to hire a caretaker, if they came to Athens to get this done solo, does the hotel have services that they can hire, or do they hire a caretaker from outside and they would come to the hotel and help the patient out? Do you know how that works, or are you not too sure?
I do know how this
okay. Of course, he's the expert.
So the plan is that we wanted to improve the experience and the comfort of patients in Athens, because there has been a feedback from patients having difficulties with finding appropriate accommodation in Athens. Airbnb platform, which is what most patients used to use in order to find accommodation in Athens, with our advice as well. It's not always reliable about amenities and about accessibility. Some locations in Athens are not very well, designed for people with mobility issues. So, trying to improve their experience, we thought that it would be better to advise them to stay at a hotel, which, in addition to all this confirmed easy access, as you said, provides other amenities like the cleaning service that you don't have in an Airbnb, meals and dinners from the restaurant. And by having the patients somewhere all together, first of all, it could create a nice hub of socializing, which hopefully would make things a bit more pleasant for them. And also, it would make it easier for our nursing team to be there on a daily basis and at a less cost and provide nursing support to all our patients.
I see.
So, I believe that this will be cost effective for the patients because they will not have to hire a nurse exclusively for them at
Right.
their flat somewhere in Athens, usually close to the physiotherapy center, but it can be somewhere around
Right.
the physiotherapy center. But the nurse could provide support and daily care to all patients at a less cost. Also, transportations. When you have people gathered together, you can easily transfer them with rides, with vehicles or taxis or vans to the physiotherapy center at a reduced cost. So I think that this option for whoever choose to go with it
Mhm.
can be cost effective and can ensure a better experience in Athens.
Yeah, that's absolutely true. I love that you explained that because when I heard
And
that from
we chose to cooperate with two hotels. One is they're both very clean and they're in the same neighborhood, just across the same road. One
yeah.
is a more boutique or luxurious option like the Grand Hyatt
Hmm.
chain of boutique hotels. The other one is a very nicely decorated and renovated hotel. It's a more
Hmm.
budget option for someone who prefers it.
Yeah.
So we try to cover all preferences and lifestyles and budgets.
That's awesome. That's really cool. Hopefully one day when I come to visit you, I'll stay at one of those hotels. So
You're very welcome. You're very welcome to visit us in Athens,
yes,
and it will be a good opportunity to meet all
yes.
members of our team
Hmm.
and be able to also provide better advice to your audience.
Yeah, I could definitely do like a highlight reel of a little documentation for everybody of the inside of Dr. G's camp at Athens BJR. Sounds like a great plan. All right. So Dr. G, we have about 10 minutes left for you. So for the next 5 minutes or so, if you don't mind, I want to take some questions from the live chat. There's a few patients who are actually watching us live right now. And then we'll just give you like a little outro, something you can say to the patients who are thinking about getting lengthening with you. So let me scroll up here and we'll go ahead and take it from the top. Let's see here. So somebody was just saying, welcome back, Dr. Giotikas. That's somebody. All right. So first question here. He's saying, where do you recommend going for the surgery, the UK or Greece? And in Athens, which is your main office, the one near the local airport or the one near the Acropolis?
Uh,
These are the questions they ask.
you need to decide. It's up to you to decide whether you prefer to come to Athens or London.
Okay.
The standards are the same. I have implemented guidelines and standards that are applied in the United Kingdom because this is where I spent the last 10 years of my professional activity.
Hmm.
So I have implemented these British standards to my practice, to both practices in London, obviously, and in
Hmm.
Athens as well.
Right.
So in terms of standards, safety, efficiency, it's up to you to decide the same. London is certainly more expensive city to live for a few
Yeah.
weeks or for a couple of months
Right.
compared to Athens, and also all medical services are more expensive in London. Um, the weather is better in Athens.
Mm.
Uh, what else? So it's up to you
uh,
to decide. For me,
okay.
it's the same. Whatever you feel more comfortable with, it's fine with me. My main office is the one near the local airport, which is not the local, it's the old airport of Athens. And this is where the hospital is located, and this is where is my office. The
Okay.
other office next to Acropolis is where the headquarters and the administration locates, so it doesn't provide any clinical care there.
Okay. Good. That's very clear. All right. Let's see here. Uh, let's see here. Okay.
So
The next question.
Mediterranean Hospital near the local airport, as our friend says, is
Oh
where
yeah.
Athens BJR is based and provides um, healthcare.
Okay. It provides healthcare. Okay. All right. The next
Free
question
healthcare.
is All right. We actually answered this question earlier, Mr. Ram. He was talking about the 1 centimeter of lengthening. So we already talked about that. So we're going to go to the next one. Here's the next question from Raymond.
No, I think that there was a slightly different point that our friend made.
Oh, was it? Okay.
One of the advantages that I have noticed with the Guichet nail that it lengthens faster. So because we give this initial 8 millimeters and then we increase during the third week the lengthening rate by 1.4, sorry. I find that at around 1 month from the surgery, we have usually achieved a lengthening of 34, 36 millimeters, which is a significant gain of time. We take into account that we have the latency period of 6 days from the surgery. So at 30 days after the surgery, being 34 or 36 millimeters of lengthening is important. It saves probably 2 weeks of lengthening compared to magnetic nails.
Oh, okay. So, okay, I missed that part of the question.
Let me take this opportunity because I remember it now. The other advantage that I have noticed, well, I don't want to say advantage, the other interesting observation that I have made, I don't want to call it an advantage first because I have not proven it. But what an interesting observation that I have made is that the callus seems to be harder and more, robust with Guichet nail. At frequent intervals, I see it being more wide, harder compared to what I used to see with other nails. We know it's well known, it's common knowledge to us orthopedic surgeons that mechanical stimulation, like weight bearing or maybe twisting, but mechanical stimulation, compression or tension may stimulate bone response and bone healing.
I see.
And my early anecdotal observation is that I see good and robust callus with Guichet nail from early on.
Wow, from early on, that's really efficient. So there's even a less worry for a non-union there. That's excellent, and that's actually kind of what this person he was saying. Okay, so he has a follow-up question: does it have to be thicker in size than the precise for the clicking to work?
Thicker. Does junior have to be thicker?
I guess.
It doesn't have to be thicker. It comes in two sizes, in two diameters: 11 millimeters and 13 millimeters.
Oh, 13 millimeters. Okay.
The 11 millimeter nail can hold up to around 65 kilograms per leg.
Wow.
And the 13 millimeter nail can hold up to 95 kilograms per leg.
Oh my goodness. That's a lot. That's significant.
We still train our patients to use their legs in a specific way during the first weeks of the lengthening in order to make sure that the nail is loaded in appropriate way and without any bending forces.
I see. Okay. Well, that's several hundred pounds that they could load the weight. So then that's a full weight bearing nail.
Thank you for making this, conversion of units.
Yeah, absolutely.
For the US
I know, because the people in America, they're like, wait, how much is a kilogram? All right. We're going to take a few more minutes of questions. Is it okay, Dr. G, for a few more minutes?
Yeah.
Okay. All right. Because we really appreciate it, guys. It's almost 10 o'clock over there, and he's staying on for you guys. So he's doing this for you. All right. From Janu, Dr. Giotikas, he wants to get your view on removing the precise nail once the desired length is reached and inserting a full weight bearing nail. Would you consider this for people who want to choose the precise option? Thanks.
It makes
kind of
sense.
like lengthening and nailing, I guess, kind of.
It makes sense when you think about it, because you allow the patient to walk with full weight bearing a bit faster than leaving them with precise nail, and then consolidation progresses for a bit more.
Right.
At the same time, it's a second surgery. It's a big surgery. It requires application of external fixator to keep the length. And there are certain places that you need to put your pins in order to not interfere with the trajectory of the nail as it comes out and as the new nail goes in. So
Well, there was a
not
surgeon the other day, and
always a straightforward surgery.
yeah.
And it's certainly a second anesthetic session with all the associated risks, anesthetic risks, and also it's another nailing with associated risk for infection.
Yeah.
And all this, what is the benefit that you get? You are able to walk. Obviously, you will not be able to walk immediately after the surgery
Right.
because of another surgical inflammation
Inflammation. Yeah.
and surgical wound again.
Mm-hmm.
So hopefully after 2 weeks you will be able to walk with
Yeah.
more
I
weight
think
bearing than what you have done with precise. But if you had kept your precise nails for another 4-6 weeks and tolerate the restriction of weight bearing, you could get away with without this additional cost, because there's a cost as well, right? So additional cost and additional risk.
Yeah, I think the premise of his question was coming from there. On the other day, I had another surgeon on from here in the United States, and they actually have a new program that they're implementing this for patients who have the precise nail, so that if they need to, they want to go back home. Yeah, so that's his question. He just wanted to get your perspective. Yeah.
Okay, very good.
Yeah.
Well, listen, in my opinion, if someone has spent 3 months mostly on a wheelchair, it shouldn't be that hard when they are already experienced patients. They are already familiar with their routine and the restriction. It wouldn't be that difficult to continue for another 4 weeks, 6 weeks until consolidation progresses further and allows more weight bearing. It doesn't have more weight bearing. It doesn't have to be full consolidation to allow full weight bearing. When it progresses at a percentage, you can allow the patients. In Athens, because to be honest, being restricted on a wheelchair for the most of the day is quite challenging mentally and also damaging physically in terms of muscle atrophy, etc. In Athens, for patients who choose to go with precise, we do have this anti-gravity treadmill.
Oh yeah, Ultra G.
Ultra G, yes, we discussed about it.
Yes.
So the idea is that it lifts the weight off the legs, and you walk on the treadmill with reduced weight bearing, like 50% of your body weight, and that way you get the chance to keep walking on a daily basis. And this gives the benefit of maintaining muscle coordination and muscle strength to some degree.
Oh, that's excellent. Yeah, I love that option that you have at your physio center there. All right, guys, we're going to take 2 more questions, and then we're going to let Dr. G go.
That was going to be my suggestion as well. 2 more questions.
2 more questions. 2 more questions.
That's what you said. My suggestion as well. Let's take 2 more questions.
Let's do it.
We're running out of time.
All right. I'll try to find this. All righty. Let's see. Let's find the best 2 questions in there. Okay. I'm going to do one for the discrepancy, folks. So this is a good question for the UK with the NHS. Would a leg length discrepancy be covered by the National Health System in the UK?
Length discrepancy, it is covered by the NHS.
It is covered. Oh, okay. All right. That's that one. And then let's take
functional. If it is functional, okay. Or in other words, if the doctor is convinced that this length discrepancy causes functional problem, like limping because of length discrepancy also usually causes persistent back pain after a period of time. So if we have those problems, yes, the NHS would cover leg length discrepancy surgery.
Okay. All right. So I have the last questions right here we're going to take it from Nicholas Morley. Can you repeat the prices? Well, we didn't actually ask the prices, but he has the prices on his website, but he wants to get your take on, do you think limb lengthening will be cheaper in about 5 years? I guess maybe the technology or the standardizations of the protocol. He wants to get your take. This has been a very popular question for patients who want to consider this expensive surgery.
I don't know.
All right. He doesn't know. All righty. Okay.
All right. Think about it for a moment.
Okay. All right. That's it. Okay. Can we take one last question? This one.
I don't think so. I don't think that it will become significantly cheaper.
Okay. You don't think so? Okay. All right, this is the very last question. I think this is a more straightforward question. He wants
And
to ask.
let me explain why that is. I think
Okay.
that there will be a gradual and steady increase of demand,
Mm,
and at the same time there will be also it's already happening a steady increase of offering the services.
yeah.
So
Okay.
you see that every year there are one or two
More.
more surgeons who enter the field.
Right.
So based on the law of demand and offering, I think that it will remain more or less the same.
Okay. All right. That's fair. That's fair. Very cool. All right. Last question of the day, and then we're going to let Dr. G go. He wants to know, do you offer unilateral lengthening for cosmetic cases, doing one leg and then, doing the other leg a couple months down the line?
I have received such inquiries. Maybe this is the same friend who asked me
Possibly.
sometime. Um, um, my understanding is that people ask this mainly because they are afraid of complications like fat embolism
Mhm. Yeah.
or other serious complications. And from that perspective, I don't think that it's worth it.
Okay. Okay. That's his thought. All right. Very
The-
cool. Well, Dr. G, they're pretty much thanking you here. He's saying that you're very thorough. They're really appreciative of you coming on. Guys, pump in the chat. Give your love to Dr. G. He's up at literally it's 10 o'clock over in the UK, and he stayed on to answer all your questions. So, Dr. G, is there any way that you want to kind of close out the show and give any words of advice, or just pretty much say something to your fans who may be considering limb lengthening with you in the future?
uh, Not really. I just hope that this was helpful for them and it increased their understanding about lip lengthening and cosmetic lip lengthening in particular. So it's been a pleasure to see you again, Victor.
Yes, absolutely. You too.
Since we are approaching Christmas, let me wish to all of you guys happy holiday season and all the very best.
Awesome. Wow. Thank you. Look at that. People are saying Dr. G, one of the best. All right. Well, Dr. G, everyone, that is Dr. Dimitrios Giotikas from Athens, Greece, and the UK in London. And he operates at the Athens BJR. If you guys want to reach out to him, you can find all of his contact links below this video, and I'll be posting them in the other limb lengthening communities online as well. So yeah, until next time, Dr. G, we appreciate it. And this is Victor from Cyborg for Life, signing out. We'll see you guys next time. Bye.
Goodbye to all of you.